Osteoporosis, also known as the silent bone thief. Today we'll be discussing about osteoporosis, which orthopedicians also call it as a silent bone killer. Well, I am Dr. Ashish Jain, Senior Director, Department of Robotics and Orthopaedics Joint Replacement at Max Hospital, Shalimar Bagh. Osteoporosis is more commonly seen in females compared to males, predominantly of certain reasons, particularly A. Hormonal imbalance. Females have low estrogen levels during menopause. Secondly, females have low bone mass compared to males. Hence, any effect on the bone mass affects the bone quality significantly. C. Low calcium and vitamin D intake. And last but not the least, sedentary lifestyle, particularly non-weight bearing exercises, all predispose to osteoporosis. So, osteoporosis has to be diagnosed because such females are more prone for the fractures of the wrist and the hip joints. And as they say, prevention is better than cure. So what are the preventive measures for osteoporosis? 1. Increased calcium intake, about 1000 to 2000 milligrams per day. Increased vitamin D intake, about 600 to 800 international units per day. Increase vitamin K, increase your magnesium and omega-3 fatty acids. They all help in bone mineralization, bone density, as well as overall bone health, respectively. Avoid smoking, alcohol, as alcohol we all know decreases the bone mass. C. Have good food habits, more of green leafy vegetables and no to junk food. And last but not the least, regular exercises. And that too in particularly weight-bearing exercises. And lastly, sound sleep also plays a very important role to have a good bone health, at least 6 to 8 hours per night to have a sound sleep. So osteoporosis, since it's asymptomatic, it's imperative that you get it regularly screened by DEXA scan and relevant blood tests. And if diagnosed, you require regular medication as per your physician.